You know the feeling, right? You touch a hot stove, your hand instantly pulls away. You twist an ankle, you immediately stop walking. Pain is completely universal. It's basically your body's most fundamental alarm system. But, well, when that pain just won't quit, millions of us do the exact same thing. We head straight for the medicine cabinet. But here's the catch. Not all painkillers work the same way. At all. Which means the specific pill you choose to swallow is actually a highly critical decision. So in today's explainer, we're going to unpack exactly what happens inside your body when you try to turn down the pain. To get there, here's our game plan for today. We'll start with the pain alarm system itself, then look at everyday painkillers and inflammation. From there, we'll dive into the opioid trade-off, why not all pain is equal, and finally, how to go about choosing the right painkiller. All right, let's just dive right in. Okay, Section 1, the pain alarm system, and how your body actually signals danger. So what exactly is pain? I mean, we usually just treat it like a total nuisance that's ruining our day, right? But in reality, it's an unbelievably sophisticated security system, one that has literally kept human beings alive for thousands of years. Think of it kind of like a smart home security system. First, you've got the sensor. That's your injured tissue, detecting extreme heat or pressure. Second is the wiring, which are your nerves transmitting that danger signal. And third, the control center, your brain. Now here's a really wild fun fact for you. While your brain is the thing interpreting all this pain, the brain itself actually has 0 pain receptors. Crazy, right? Anyway, when you take a painkiller, you gotta remember it doesn't magically erase the actual injury. It simply hacks into this specific pathway to just turn down the volume. So how do our most common tools actually pull off this hack? That brings us to Section 2, everyday painkillers and inflammation, or basically organizing your household toolbox. Take a look at the everyday drugs we honestly just assume are completely identical. They're really not. Acetaminophen operates primarily up on your central nervous system, which means its main risk profile centers directly on your liver. But on the flip side, things like ibuprofen, naproxen, and diclofenac, those are NSAIDs. They work by inhibiting COX enzymes, which actually shifts the primary risks down to your stomach and your kidneys. Now, here is exactly why that distinction is an absolute game changer. Acetaminophen is a total rock star for reducing a fever because it does its work up in the brain, but it has almost 0 anti-inflammatory power. None. NSAIDs, however, tackle pain, fever, and inflammation. So, if you've got a fever, acetaminophen is your best friend. But for a super swollen, angry, sprained ankle, an NSAID is physically equipped to tackle that swelling in a way acetaminophen just literally isn't. But we've got to talk about a massive, massive warning here. When it comes to this stuff, more is definitely not better. Because acetaminophen is put into so many different products, accidental overdoses are shockingly common. Think about it. You take a pill for your headache, and then later you chug some nighttime cold syrup. Completely unaware, you just double dose the exact same chemical. That can severely overwhelm your liver. Seriously, always check those labels. Okay, so how do NSAIDs actually reduce that swelling we talked about? Well, they block your body from making these chemicals called prostaglandins. You can think of prostaglandins as sort of like chemical flare guns shot off by injured tissue to cause pain and swelling. Stop the flare guns, stop the swelling. Simple, right? But here's the catch. Those exact same flare guns are also responsible for telling your stomach to maintain its protective lining and keeping the blood flowing to your kidneys. So when you block them to fix your swollen ankle, you inadvertently drop your shields elsewhere in your body. This is exactly what unlocks the hidden risks of NSAIDs: stomach irritation, decreased kidney function, and even gastrointestinal bleeding. So yeah, just because you can grab it off the shelf at the grocery store doesn't mean it's universally risk-free. Which brings us to the heavy-duty stuff, the medications used when everyday options just aren't cutting it. Section 3. The opioid trade-off. What happens when the alarm requires a complete system override? For major surgeries or cancer treatments, the biological strategy shifts entirely. Opioids, like morphine or oxycodone, target the opioid receptors in your nervous system. But here's the thing. These receptors don't just sit at the site of a cut on your arm. They're heavily involved in your emotional responses, your reward pathways, and even your breathing. So opioids don't just block a pain signal, they completely alter how your brain emotionally cares about that signal. You still feel it, you just don't really care. But this creates a major biological cascade, the opioid trade-off. Because the exact same receptors that alter your pain also control vital keep-you-alive functions. So you get the pain relief, yes, absolutely. But you also get drowsiness, confusion, and most critically, slowed breathing. That respiratory depression, that is exactly what makes an overdose so incredibly dangerous. While we're on the subject, it's totally crucial to separate two deeply misunderstood biological terms. Tolerance means your body adapts, requiring higher and higher doses to get the exact same pain relief. Dependence, on the other hand, means your biology has literally structurally adapted to the drug's presence, leading to physical withdrawal if you stop suddenly. I want to be clear, these are natural, physiological adaptations. They are entirely separate from the behavioral disorder of addiction. Because of these profound whole-body effects, the medical consensus is super clear. The strongest drug isn't always the best drug. Throwing a heavy-duty opioid at the wrong type of pain can actually cause way more harm than good. And that leads us to an absolutely vital concept in this explainer. Section 4, not all pain is equal, matching the tool to the problem. So why can't we just give a strong pill to everyone who hurts? Well, because pain actually comes in fundamentally different flavors. Nociceptive pain is hardware damage. Think a sprain, a burn, arthritis. Anti-inflammatories work great here. But neuropathic pain? That is a software glitch. The nervous system itself is misfiring, creating these weird burning or electric shock sensations. Ordinary painkillers are practically useless against a software glitch. You need entirely different, highly targeted treatments to address those nerves. We also have to categorize pain by time. Acute pain is sudden, like a broken bone, and it responds really well to short-term medication. But chronic pain, that is persistent, complex, and deeply rooted. You literally cannot just indefinitely swallow painkillers for chronic pain. It requires a completely different, holistic puzzle of physical therapy, lifestyle changes, and treating the actual underlying disease. So let's put this whole puzzle together. Section 5, choosing the right painkiller. The diagnostic puzzle. I really want you to consider this before you open your medicine cabinet next time. What actually determines which painkiller is safest for you? Not for your partner, not for your neighbor, but for your specific, unique biological fingerprint. The answer almost always lies in hidden risk factors. Things like your age and your kidney function drastically change how fast drugs clear out of your system. Being pregnant rewrites the safety rules entirely. Pre-existing conditions, like an old stomach ulcer you might have forgotten about, can make an over-the-counter NSAID highly dangerous. Even your genetics dictate how quickly your body metabolizes certain drugs. Toss in your other daily medications, and you can see why your risk-benefit balance is uniquely yours. Ultimately, if you take nothing else away from this, remember this single vital truth. Pain is information. If you have a sudden blinding headache or out-of-nowhere chest pain, arbitrarily suppressing that sensation with a pill might mean you are literally ignoring a life-threatening medical emergency. Your body is trying to talk to you. Pain is a warning. Painkillers just turn down the alarm. Finding out why it's ringing in the first place is the most important step you can take. So the next time you reach for that bottle, I want you to ask yourself, are you actually putting out the fire, or are you just taking the batteries out of the smoke detector? Think carefully about the incredible biological tools you're using. Thanks for joining us for this explainer, and we'll see you next time.